Welcome to Talk Time Tuesday, where we're all about empowering you and giving you information so you can take control of your own health. We're your hosts, Dr. Ashite and
Dr. Dharma, the nagging doctor.
All right, and this week we are talking about... It's not that exciting. Cervical cancer. All right, so January
They already exited out.
You know,
They stopped.
they're like
already.
cervical cancer. We're not listening anymore.
Next.
Come back. This actually is an important thing, right? You know, how many times do you see people who've like not had a pap smear for like 10 years, 15 years, you know, and why die of a disease that is preventable on so many different fronts? So, yeah. I'm going to ask you questions. You can ask me questions. Let's do it that way. So what is cervical cancer?
Okay, so cervical cancer is cells in your cervix that divide abnormally and then grow just like a cancer. And your cervix is the end part of your uterus. So your uterus is the organ that you have babies in. And at the end of the uterus is a little opening called your cervix. And those specific cells tend to lead themselves easily to become cancerous and precancerous. So it's a test because we're able to check it real easy.
Right.
When we look at the vajayjay.
Cervix.
Yeah, we're going through the vagina, look at the cervix, and we can take a sample and then see if there's any cells that are dividing abnormally that could then lead to cervical cancer.
Right. You know what's interesting? I have learned that a lot of people do not know what the internal female anatomy looks like. And I've had to like show pictures and break it down. You know, this is the outside, this is what the vagina looks like. The end of it is the cervix, which is closed. Okay, this may sound crazy, but there are people who believe that when you have sex, the penis is going all the way into the uterus. I swear, I know educated people. I really do. Okay.
No, wait. My favorite is when, when people wear the Nuvo ring and then they're like, oh, they can feel it. I'm like, no, they can't. Yeah.
No, but just...
There's we hear so many things. You know, the other part that was interesting is if you don't have a uterus, sex is no longer pleasurable. So I have a lot of women who end up not getting a hysterectomy because
of that reason.
Because they feel like they're not going to be women anymore.
Which is not true.
There's a lot of rumors about the uterus. You know, one thing... have you heard of those, the bleeding cups? Because they didn't have that in my day.
The period cups?
Yeah.
Yes, and I use them.
What?
Yes! Oh my God. Changed my life. Yes.
Yeah, I mean, my daughter was asking me about it. I was like, what is that?
Yeah. Oh yeah. The Diva cups and they it's a life changer. Life changer for sure. Yeah, but so many things having to do with female anatomy that sometimes it feels like, oh, it's a vortex out there. But today, really bringing it back in. Our focus, I mean, we could have a day where we could spend time like going over just teaching people the anatomy, what happens in your cycle, you know, and all that. Anyway, if you're interested in that, you can let us know. If you're not, we'll just keep going because sometimes we feel like no one's listening anyway.
But it's fine because we're just like talking. But you know, I do have to tell you this one interesting story about a cervix real quick.
All right, I'm listening.
Okay, so it was a long time ago. Dr. Clark had a patient and they had heard that if you slice a piece of potato and put it up into your vagina near your cervix, this is a true story, that it will stop you from getting pregnant. So she did that, right? But, no, it gets better. She then, after having sex and all that, thought the potato had...
Wait a minute, she could have sex with the potato?
Because the potato stops you from getting pregnant, according to, I don't know what, but that was her thing, okay?
Okay.
Long story short, you know, she started to have a foul odor coming from her vagina. And then Dr. Clark went in, did a pap, and looked, and she had a fungating mass. Fungating means like a mass that is like growing, and she thought it was cervical cancer. So it actually applies. I know y'all thought I wasn't staying on target.
I would have thought that was cervical cancer.
Yeah, so it was like this thing that had sprouts and
yeah, because a potato will sprout. Okay.
Yeah, in a warm, dark place. And so yes, she did a biopsy. And yes, the pathologist was like, this is organic. It is not of human. And so when Dr. Clark asked her, the woman was like, oh yeah, potato contraception. I swear. And so it wasn't cervical cancer, our topic for today, but it was potato with like fingerlings. And so that was what the odor was from. So on a side note, potatoes are not effective in contraception. And just in case anyone else was like the need to know. Okay?
Do not stick a potato up there.
Yeah. So cervical cancer.
Yes, cervical cancer. So abnormal cells. Okay, so we talked about these abnormal cells that develop, and they come from a place, right? There's something that causes it. It's the HPV virus, which is the human papilloma virus. I've had people confuse human papilloma virus with herpes. They're not the same thing.
Yeah.
HPV, your body can get rid of. Herpes is forever.
Yeah. So the HPV used to be from 9 to 26, but now your insurance will cover it until 45. And it is for both boys and girls. And it's a vaccine with the high-risk strains that can cause dysplasia, which is abnormal cells in your cervix, which then can lead to cervical cancer, okay? And so it's really beneficial because it is the only cancer that you can get from a STI, sexually transmitted infection. And it is the only cancer that is preventable with a vaccine. So that's a big deal.
It is a big deal.
And the reason, like, we are putting it all out there, and that's why we like these kind of videos so that we can really talk to you about it. So why do boys get it? Because they don't have a cervix.
Right. Well, oral cancers.
Exactly.
Yeah.
And people have oral sex.
I know.
It's
so surprising.
Yeah. Shocking. But they do. People have oral sex. And so then you can get cancer. So head, neck, and throat cancer is really big. And the same virus that causes from, there aren't that many holes on our body, right? How many holes are there in your body? 1, 2, 3. Yeah. Well, yeah. So 1, 2, 3, 4, 5. Well, this is 1, but your urethra.
1 or 2.
Oh, that's such a good.
There's so many orifices.
Okay, and then your ears. Yes. I guess that's a hole, but it doesn't really go. It's a dead end.
That isn't, but it's still an orifice.
It is a hole.
Because technically, the vagina is an orifice. Oh my god. Oh my god. Oh my god. Can we focus?
Oh, I didn't take my medicine. I'm actually untreated ADHD. I untreated many things, but no. That's a whole nother complex. We need to do a talk on ADD and ADHD.
Yeah.
That's I need to do that. Okay.
When you've got it, this is what happens.
All right. So HPV, boys and girls, 9 to 45. Okay. And it will prevent cancer. Okay. And just on that note, you can have. People think HPV is also the condyloma, but there's a condyloma, which is the human papilloma virus, but those are a different strain.
Right.
And so they look different, and those strains don't actually cause cervical cancer. Okay, so how to prevent cervical cancer? How often do we screen for cervical cancer?
All right, so here's the good news, ladies. Actually, this has been the case for a while, and a lot of people do not know this. You don't have to have a pap smear every year.
What?
I know. So awesome. Okay, so if you are less than 30 years old, so from age 21 to age 29, you get a pap smear once every 3 years. However, once you turn 30, you have the option to be screened not just for the types of cells you have on your cervix, but whether or not HPV is present. And so if your doctor did a pap smear on you that had also checked for HPV, then you don't need another pap smear for 5 years. And this is important because a lot of people tend to think that just because I'm 30 or 35, it's okay for me to have a pap smear every 5 years. But the key is whether or not you got that HPV screen.
Correct. And also, oh God, there's so many things. So we used to do PAPs if you were sexually active at a young age.
Right.
And so I have people who still come and bring their 16-year-old and they want them on birth control. And then they say, well, they need a PAP because you did a PAP on me when, I was like 20.
Dang, how old are you?
I know. I knew you would say something like that to throw me over the edge. All right. Focus. Okay, so, and they bring them in and they think that they need a PAP to get contraception. And so, yes, that is true. We used to do that. That is what we used to believe, but we now do not hold people by contraception. And if your kid needs a birth control, we're happy to give it. They don't have to have a PAP. But that's when we also would talk to you about HPV, okay? So 21 is the age that we start. And the reason that we do that, I always try to explain the why, because the why is really important.
Right.
So the reason that we do that is that what we realized is that when people had abnormal PAPs and they were really young, we would do all these like very invasive procedures, meaning we would cut it out, we would burn it, freeze it, because we were like, oh my God, they have cancer, or we need to stop it. But then what we realized is that cancer, because it has HPV in it, can sometimes just go away. When the HPV just goes away, just like any other cough, cold, viral thing, it can just literally go away. Then so do those abnormal cells. So 30% of people's abnormal cells just go away. 30% of that age group stays the same, and we just have to monitor it. So if you have an abnormal PAP with HPV, then you have to get tested much more regularly based on the reading. So what Dr. Ashite was talking about was in regards to if you're normal screening, okay? Right. But then 30%, so 30, and then the last 30%, unfortunately, can progress into cancer. And so on those people, that's why we watch. When we know you have HPV, we really keep a close eye on it because we think, okay, it might change. But we no longer do these procedures, biopsies, colpos, leaps, all those are big words for burn, freeze, fry. And what it did later on is when these girls got pregnant, they weren't able to hold their babies because their cervix had been damaged. So medicine is a constantly evolving field that learns. And so that's the why behind what we're doing now.
Right, yeah. I know there's been a lot of laughing and it's, medicine, talking about medicine can be fun and body parts and all of that. And yes, it is true that our bodies can clear HPV, but don't use that as an excuse to not get screened. Because unfortunately, if you do get widespread cancer from cervical cancer, even vulvar cancers, because it can cause that too, HPV, the treatment is not that great if it becomes extensive. And I had a friend actually this year who passed from that.
Really?
I did. Yeah. Young. She was a year younger than me.
Like in the United States?
In the United States of America. Yeah.
How has that happened? I mean, I don't understand.
Well, there's more to it. We think that, she had other immunocompromising conditions. And had to be on medications that lowered her immune system. And so we really do think that it was a battle between one versus the other. And at some point it just wasn't.
Yeah, it's just so hard to, when I really was like, I don't understand, because I don't understand how people die of diseases that are treatable, curable, preventable, like how does that happen, I get it when someone has a brain tumor because we don't have a screening test for it, or pancreatic cancer, although everyone's working on that. And so when you can't find it until the late stages, like ovarian cancer.
Pancreatic.
Then I get that. Yeah. But when you have something that is truly preventable, then that's a hard loss,
Right. Yeah. So.
I think we went over all the most important parts of cervical cancer screening and HPV. So hopefully you learned something. Even if you don't have a uterus, you can educate somebody that maybe does.
Yeah, ask your sister, ask your wife, ask your partner. Hey, are you up to date on your pap smears? Have you had the HPV vaccine? And guys, this talk was for you too.
Up to 45.
Right, get your vaccine.
Yeah. All right, guys. So we look forward to seeing y'all on our next Talk Time Tuesday. If you have any questions or suggestions or topics that might be of interest to you, then just leave it in the comments below, and we'll just keep talking because, that's what we do best.
Bye-bye.